Okay, welcome to session number 7. And in this session number 7 of veterinary pharmacology, we are going to discuss pharmacotherapy of candidiasis and dermatophytosis in cattle. So, candidiasis in cattle and dermatophytosis in cattle. Now, let us begin with candidiasis. Candidiasis in cattle. So, by beginning with the definition, candidiasis. This is It is an opportunistic pathogen which results into systemic or local candida infection in cattle and calves, which are secondary to prolonged antibiotic or corticosteroid therapy. So this is the disease caused by Candida albicans. It can be caused by Candida albicans, and the disease normally affects the mucous membrane, especially of the alimentary canal. So the mucous membrane of the alimentary canal is affected by the Candida albicans. So it is an opportunistic pathogen. Opportunistic means when the body defensive mechanism or the body immune system goes down, then the particular species of the Candida multiply and increase in number and causes infection. And this drop down in the immune system can be caused by corticosteroid therapy, or it can be caused by death of the normal flora in the animal body, and the normal flora of the animal body in the GIT can be reduced in number by prolonged use of antibiotics. If you use antibiotics for a very long period of time, you affect the normal flora of the GIT of the animal. And the normal flora of the GIT are very important, and they play a very great role in the immune function of the animal body. So the prolonged use of antibiotic reduces the effect of normal flora, and hence it causes drop down in the immune system, and that can cause overgrowth of Candida albicans that causes the infection. And also corticosteroids are known to reduce the normal body immune system, and if it is used for a long period of time, it affects the immune system and causes the Candida albicans to overgrow and to cause Candida infection. And the outcome of this candidiasis can cause mastatitis and abortion in cattle. Mastatitis, the inflammation of the udder and of the breast, and then the abortion can occur in cattle. And the signs and symptoms include watery diarrhea, anorexia, dehydration, and also lesions in the skin and mucosa, and are generally single multiple raised circular white masses covered by the scabs. As you can see this picture, these are lesions which are white masses, and at the top of those white masses there are brittle things over that particular lesions which are formed. The organism can penetrate keratinized epithelium and cause marked keratinous thickening of the mucosa of the tongue, esophagus, and the rumen. So sometimes you can see formation of keratinized epithelium. So epithelium which is hard. So the tongue and the esophagus and the rumen can overgrow with a hard epithelium, and that epithelium is a keratinized epithelium. So it is a hardened epithelium over the tongue, esophagus, and rumen. The candidiasis can be treated by nystatin as an ointment for topical application, and also of iodine solution, and that can be useful for oral cutaneous mucosa. So iodine can be used, iodine solution or nystatin, and those are applied topically. Ketoconazole can be used for 2 weeks. Ketoconazole can be used. And the contraindication of ketoconazole, we all know the contraindication of ketoconazole is liver impairment, and also pregnant and lactating animals are not allowed to use ketoconazole. And the side effect of ketoconazole, we all know the side effect of ketoconazole involve hepatotoxicity, GI disturbance, pruritus, alopecia, gynecomastia, and sexual impotence and infertility. So those are the common side effects of ketoconazole, which is a very common drug for treatment of candidiasis in keto. So we are done with candidiasis in keto. Let us continue with dermatophytosis. Dermatophytosis. And whenever you hear the word dermato means something to do with the skin. So dermatophytosis. This is the disease of conified epidermis. Epidermis with cone layer, a hard layer of dead tissue. So that is conified epidermis. Dermatophytosis, the disease of conified epidermis, and it involves hair, horn, and nails. Hair, horn, and nails, and most frequently is caused by fungus of the genera Microsporum and Trichophyton. So these genus are very commonly cause of dermatophytosis, Microsporum and Trichophyton. And the transmission occur between animals or by contact with soil. So from one animal to another, or through soil which is contaminated with these funguses, the fungi. So high humidity and temperature, trauma, poor nutrition, and most importantly, close confinement are predisposing factors. So even though the fungi can cause disease in cattle, but there are these predisposing factors, and these predisposing factors include high humidity, high temperature, trauma of the animal, or poor nutrition, and also close confinement. If the animal is in a close confinement for a period of time, it can be a predisposing factor for dermatophytosis. Signs and symptoms include infected hair become brittle, dry, and lustless, and break off. So we know these animals, the cattle, their fur, their hair is very softy and very shiny. You see, a healthy cow, you will find out the hair is shiny and is very soft. But if the animal has dermatophytosis, the hair becomes very brittle and it loses the shiny appearance of the skin. So the skin loses the shiny nature of it, and also it can easily break off. Because it is brittle, it can easily break off. So nywele zinaweza kuwa kama zile zinavunjika vunjika, alafu zinapoteza ule mng'ao wake, ule mng'ao wa nywele za ng'ombe unapotea, na hiyo ni kwa sababu ya dermatophytosis. So ring-shaped lesion develop which becomes alopecia. Ring-shaped lesion and then becomes alopecia. Ring-shaped lesion maana yake kunakuwa na vijiduara duara ambavyo vinajitengeneza kwenye ngozi, alafu hivyo vijiduara, kwenye hivyo vijiduara nywele zinakuwa hazioti hiyo sehemu, kwa kunakuwa na alopecia. The place becomes alopecic, that area with the lesion. Kwa mnafahamu wote fungus ilivyo, ikiota kama ni kichwani kwa mtu, ile sehemu ambapo imeota ile ring, ile shilingi lilipoota pale, nywele hazioti. So it is the same applied to cows. The area where this fungi has developed a lesion, around the lesion, or the whole part of the lesion becomes alopecia. Treatment, you can use iodophor as a topical treatment. So in the treatment of this fungi is either you can use topical treatment, or you can use topical, or you use topical and systemic treatment, or topical and systemic therapy together. So you use iodophors, you use 3% spray, you spray it on the animal every 24 hours for several weeks, depending on its response. So you spray it every 24 hours until you see the disease is going away. And the side effect, it can cause irritation to the animal. So this is by spray, and also concurrent use with other antiseptic and detergent is not allowed. So it is contraindicated with other antiseptics and detergent. So after using iodophos, do not use antiseptics and do not use detergent. Another topical application is sodium hypochlorite, and this is by irrigation. You do not spray. The iodophos is by spraying, but sodium hypochlorite is by irrigation, and this happens for every 24 hours in several weeks. Okay. So systemic therapy, that was topical. Systemic use sodium iodide, which is intravenously applied, and also glucosulfin, which can be given every 24 hours for 7 or more days in calves. So the side effect of glucosulfin is high dose can cause hepatotoxicity, leukopenia, and hypoplasia. And the glucosulfin is contraindicated in hepatic impairment and also is contraindicated in pregnant animals, as it can cause abnormalities to the unborn animal, that is cleft palate and skeletal abnormalities. Important thing to note about the treatment of dermatophytosis is that topical and systemic therapy are employed together. So topical therapy and systemic therapy, it is applied concurrently. That is it for uh, dermatophytosis. And the key points to note here, you can read these key points to note for the case of uh, candidiasis together with the dermatophytosis. And remember to answer these questions as you can find it here. And also you can include questions for dermatophytosis, defining common side effect and pharmacological treatment. You can do that for dermatophytosis and for candidiasis. Thank you very much for listening. You are welcome for questions.